Okay, and we're live. Okay. Hello, everyone. My name is Raymond Moses. I am the sole proprietor owner of my consulting business, Digital Electrons Web Solutions. Basically, I'm here to talk to you today about claimant reimbursement advice for federal workers' comp. So let's get straight to it. So what I'm going to talk about is the forms first. Okay. So you're able to access the claimant reimbursement form either directly on the web bill processing portal website, which would be right here. This is the newly revised portal. At least it used to look different 2 years ago since the company CNSI took over. Probably for the better. So let's see here. Forms and references. You're also able to access the form on the Department of Labor website as well. So as you can see here, here's the claimant reimbursement form, the claimant medical reimbursement form. Let me be specific. Of course, you can also get that here as well. Right here. Boom. Okay. And I'll have the links below. Now, the reason why I'm here to talk to you about the claimant reimbursement form is because a lot of people are in a situation where, one, they had to claim medical reimbursement for services they had to pay before their case was established and before they got their pharmacy card and things of that nature. Or maybe when you go to the pharmacy and you try to get a prescription, there was a billing error. Maybe the pharmacist didn't know exactly how to bill workers' comp, or maybe something wasn't set up, or maybe they reached a term limit and had to re-enroll their provider ID, because a lot of pharmacies, have different provider IDs per location and things of that nature. So it could be a lot of things, honestly. And maybe you were in a situation where you're forced to pay out of pocket, right? But what I'm really here to really talk about as well is how you can also get over-the-counter prescriptions that are backed by medical necessity from your medical professional, which needs to be either a licensed MD or DO, still a doctor. Yeah. So you want to get that reimbursed. Okay. So as you know, you put you put all your personal information in here, claimant case number. Yeah, and ideally you have to attach a receipt or an invoice, right? Some proof of payment, and you do have to right here. Yeah, as it does say here, they do want you to put what you can. Now, two things that trouble people is, one is the national drug code. Each pharmacy item has a national drug code, and when a bill processor is processing your claim, they want to be able to enter the drug code and see if it's eligible, right? Because Department of Labor does have a list of drugs that are ineligible for reimbursement. So sometimes, especially for important items like painkillers and stuff, they want the national drug code. Normally that's something you can find online, and I have helped claimants find these national drug codes. I'll put a link in the description on how you can search for yourself, because I've dealt with claimants who are dealing with denials for months, and when you call the call center, a call center agent isn't going to help you find the national drug code you want to get reimbursed. Now, another issue I want to talk about, and this is the most important one, is why you want your over-the-counter drug reimbursed. Okay, so let's say you are dealing with a gastrointestinal issues. If I'm saying that right, I apologize. Or maybe you're dealing with cardiovascular issues like poor blood circulation in the leg, or the lymphatic system as well, right? And you need over-the-counter assistance to help you rehabilitate. So you can take something like an electrolyte powder, for example. This is Dr. Eric Berg electrolyte powder. This is not a paid advertisement for him, but this is something I personally like. Okay, so one of the main components here is potassium citrate. Now, and of course it has a lot of other trace minerals as well, as magnesium, um, chloride, and sodium from pink Himalayan salt, trace mineral complex. Now, I really like Dr. Eric Berg's electrolyte powder supplement because a lot of the choice minerals he has are easily absorbable. Because if you research it, the problem with potassium chloride, right, is it makes your kidneys work a little more to, break it apart and get the potassium, which also kind of gives a dehydrating effect and things of that nature. But potassium citrate, it's not dehydrating. Your body absorbs it quickly. Now, so why this is important, right, is because this can help with, facilitating more bowel movement, more smooth muscle movement and contractions if you need that support for your gastrointestinal issues, or maybe you're having like nerve damage issues, maybe from, stemming from an underlying issue like diabetes, pre-diabetes, or carpal tunnel syndrome in your wrists, things of that nature. Now, of course, you want to do two things. One, you want to talk to a nutritionist, ideally, and get the consulting, have the nutritionist document saying, hey, this is a medical necessity for why you need these things. And then you can take that information from that licensed nutritionist you talk to, or someone of that nature, a dietitian, and take it to your doctor and say, hey, look, I've at consultation, I've been trying this over-the-counter product. It's really been working for me. I really need you to also agree with this opinion of medical necessity so I can have documentation from you, my licensed physician, and I can attach this with my claimant reimbursement form when I send it, to the when I send it to the Federal Workers Comp, department for reimbursement, right? Okay, that's as straightforward as it gets. Now, that's one reason why people are having denials with over-the-counter products. You're not going all the way with getting proof of reimbursement. Okay. Now, one issue here is the medical billing code you have to show. Okay. That could be like a CPT. Oh, well, let's pull it up. I'll show you. So, the medical fee schedule, Department of Labor's medical fee schedule, tells you what codes are reimbursable, right? And again, I'll have this link attached as well, and I've already been writing about this in my blog since 2019. I just want to make a video to show how simple it is. So you want to accept agreement. You can go to the most recent effective date. Okay. View fee schedule files. Now you want to go over here. You see where it says here CPT codes. Again, CPT is basically the medical billing codes for medical procedures. All right, CPT codes. Okay. As a medical billing professional, yeah, this is also very important for you as well. If you work in the medical industry and you're trying to seek reimbursement and things like that. Now, your web bill processing portal account as a claimant or provider can also tell you if a code is eligible against a file. There is a medical billing code checker, which I'll talk about in another video when I go over the web portals. Okay. So let's let this load. Taking your sweet time, I see. Okay. Goodness gracious. One moment. Bear with me. Yeah, that was a pretty big file. So you're going to do the Control F, the Control Find Search tool, quickest way to search through it. I'm just going to hit Control F on the vitamins. Make it quick. Just minimize out of that. All right, so we're going to hit Control F. Vitamin. All right, we got skipped over here. Yeah, here we go. It's right here. Apologize, it took a while. So yeah, see right here where it says vitamin. Okay. Now, even though it says D for denied as in not covered, if your claims examiner is able to give an override, you are able to get an override. So that's something you want to keep in mind. I've basically seen it for like a cancer patient where claims examiner and the internal and the document tracking system that is internal with the call center and the Department of Labor district offices. They can they create threads where the claims examiners and the people at the claims examiner's office, like the medical coders and the nurses and all the people on the medical review unit, they can talk about these things. So it is still something reimbursable, right? Especially right here, non-prescription drugs, so you want to keep things like that in mind. So yeah, basically that's pretty much all I wanted to say today. So feel free to contact me if you do have questions about pending issues, and I'd be happy to go over things. So again, I want to say thanks for your time, and I'm signing off. Thank you.